Thanks for joining us on this Tuesday night.
Good evening, everyone. We begin tonight with news out of Sacramento. Governor Gavin Newsom unveiled his 2022-2023 budget proposal just yesterday, and universal health care is one of the most sweeping changes coming to the state of California. KION's Lisa Principe explains who qualifies and how it could help low-income families, including those who are undocumented. Lisa?
According to the UC Berkeley Labor Center, undocumented Californians make up the largest group of the uninsured population, with nearly 1.3 million under the age of 65 without insurance. The governor's proposal aims to change that.
We have universal health care in this state and in this country, but it's on the back end. It's called the emergency room. And it's costing you, the taxpayer, a fortune.
Universal health care for all. Under Governor Newsom's plan, medical coverage would be extended to all low-income Californians, regardless of age or immigration status. This would extend coverage to an estimated 700,000 people, provided they meet the income criteria. For a family of four, that means making less than $36,570.
The ability to increase their health care would obviously allow them to have more money in their pockets to spend at local stores, to spend on other family needs, on other basic needs.
Raymond Cancino, CEO of Community Bridges in Santa Cruz County, says the proposal will cover many of those who are most vulnerable, which has been highlighted during the pandemic.
There's a lot of correlation with obviously wages and how you're able to deal with this pandemic. Not everyone can afford to get food delivery to their house. Not everyone has the luxury of staying at home and working from home. And so all those different realities, causes people to be more exposed and to also have a greater need of healthcare.
The state is expecting a $45.7 billion budget surplus. The governor's office estimates the cost for the proposal will be $614 million for the upcoming fiscal year and $2.2 billion annually after that. Universal access would be fully implemented by January of 2024.
To make California healthier future and to reduce costs over the long run, because if we're not doing that now, we're going to do it when the person is immediately really ill, and healthcare in terms of emergency costs are a lot more expensive than a regular doctor visits.
And the state legislature has until June 15th to pass the new budget, while Governor Newsom has to sign it into law by June 30th. In Salinas, Lisa Principe, KION News Channel 546.
Lisa, thank you. Well, some other highlights here from the governor's budget proposal: $2.7 billion to fight COVID, $2 billion to fight homelessness, and a plan to tackle the high cost of living here in the state of California. Another $22 billion to combat climate change.